Yeah. Consent agenda, everything's approved.
I read the minutes from last meeting. You guys had a quick one without me.
It's because you weren't here to ask questions.
That's exactly what I'm saying. That's what I'm saying.
He was intimating that, I think.
You're welcome.
Were we thinking you or?
You're welcome that I wasn't here. That's what
Oh.
Yeah.
I'm good, how are you? Good.
Oh, yes.
They are.
Good evening. We're going to call the McHenry County Board of Health meeting to order for March 11th, 2024 at 6:33 p.m. Roll call of members present, please.
Ms. Gaffney?
Yes.
Ms. Carmen?
Yes.
Ms. Eltoff?
Here.
Ms. Clark?
Here.
Mr. Markison?
Here.
Dr. Amsar?
Here.
Ms. Borowski?
Here.
Dr. Katz? Here. Mr. Clark?
Here.
Ms. Ortiz?
Here.
Do we have any public comment tonight?
Mr. President, one correction, March 18th.
What did I say?
March 11th.
Okay. Thank you.
And they were moving.
Hearing and seeing nobody for public comment, we'll move on to approval of minutes.
I make a motion to approve the minutes from November 20th, January 22nd, and February 12th,
I second.
We just note that it's November 2023.
2023, yes.
Doobies on the side.
No problem.
Does any member have a concern about all the minutes being done at one vote? Everybody's fine with that? Okay, the motion was made by Ms. Carmen, second by Ms. Gaffney.
Yes.
All those in favor of the motion, say aye.
Aye.
Those opposed, say nay. Ayes have it. Motion carried. Next item on the agenda is special recognition. I'd like to start out by reading the proclamations. The first one is for National Public Health Week for 2024. Whereas the week of April 1st through the 7th, 2024 is National Public Health Week, and whereas the goal of the National Public Health Week is to spotlight the achievements of public health and recognize public health professionals' contributions to improving the health of the people of the United States and achieving health equity. And whereas this year's theme is protecting, connecting, and thriving, we are all public health. And whereas during National Public Health Week, we celebrate the accomplishments of the Department of Health and the role of our board, staff, volunteers, and community partners play in protecting and promoting the health, safety, and well-being of those who live, learn, work, and play in McHenry County. And whereas the McHenry County Department of Health is the public health authority in the county and assists our communities in preparing for, mitigating, and recovering from the impact of a full range of health threats, including foodborne, waterborne, vector-borne illnesses, disease outbreaks such as COVID-19 pandemic, vaccine preventable diseases, chronic diseases, and rabies. And whereas this year's theme acknowledges that creating the conditions where everyone has the opportunity to be healthy and thrive takes collective action and underscores the importance of collaboration and partnership to address health outcomes for everyone. Now, therefore, be it proclaimed by this McHenry County Board of Health in McHenry County, Illinois, that the members of the board recognize and offer their appreciation for the dedication, expertise, and tireless efforts of the McHenry County Department of Health staff, volunteers, and community partners for their contribution to public health and the role in creating a healthy McHenry County for all. Be it further proclaimed that the county clerk is authorized to distribute a certified copy of this proclamation to the county administrator and the public health administrator, dated at Woodstock, Illinois, this 18th day of March, 2024.
Mr. President, I would like to make a motion to approve and to distribute the proclamation for Public Health Week 2024.
I'll second that.
A motion has been made by Mr. Markinson, seconded by Ms. Altoff. All those in favor say aye.
Aye.
Those that oppose say nay. Ayes have it, motion carries. Thank you, everybody. Okay, the next proclamation is, gotta find it. Animal Care and Control Appreciation Week 2024. Whereas each year the National Animal Care and Control Association celebrates Animal Care and Control Appreciation Week during the second full week of April. And whereas various federal, state, and local government officials throughout the county take this time to recognize, thank, and commend all animal control officers and veterinary division staff for their dedicated service they provide to the citizens, public safety, and domestic animals and livestock across the nation. And whereas every day animal control officers and kennel staff put themselves in potentially dangerous situations to protect the health and welfare of all kinds of animals and the public. And whereas McHenry County Department of Health recognizes and commends the Veterinary Public Health Division personnel who answer calls for assistance 24 hours a day, capturing, roaming, and potentially dangerous animals, rescuing animals, investigate reports of animal abuse, educate pet owners about responsible care, and mediate disputes between neighbors regarding pets. Now therefore be it proclaimed by the Board of Health of McHenry County, Illinois, hereby proclaims April 14 through 20th, 2024 as Animal Care and Control Appreciation Week. Be it further proclaimed that the county clerk is hereby authorized to distribute a certified copy of this proclamation to the Director of Veterinary Public Health, County Administrator, and the Public Health Administrator, dated at Woodstock, Illinois, this 18th day of March, 2024.
Mr. President, I'll make a motion to approve and distribute the proclamation Animal Care and Control Appreciation Week 2024.
Second.
Motion has been made by Mr. Markinson, seconded by Dr. Amsler. All those in favor of the motion, say aye.
Aye.
Those opposed, say nay. Ayes have it. Motion carries. Item number 5, Department and Division updates. Ms. Sampson?
Okay. I just have one thing, some of the other things we'll talk about later in the agenda. Paid leave for all. Has anybody heard about this in the news? For all workers. Okay, so it took effect as of January 1st, 2024. It establishes minimum paid leave standards for all Illinois workers. There are some exceptions. The reason we're bringing it up now is as of March 31st, 2024, people can start using their time. So it establishes, again, this minimum standard of 40 hours for everyone. And the other notable item is that you can take leave for any reason. So, and you're not obligated to inform your employer. So right now, the county benefits exceed the new law, and the county has an ordinance. So there's only going to be a few things that change for our employees or for all county employees. And again, I'll walk through some of the exceptions. So those of us who are accruing at a much higher rate than the 40 hours, which is essentially everyone on staff, we don't get new accruals. It's not like we're getting an additional 40 hours of time. However, we will have 40 hours of essentially paid time off that we can use for any reason without any explanation. And because we have vacation time, sick time, personal time, employees will have to, so they don't have to tell us why they are using their time. They can say, hey, I would like to use 10 hours of paid time off. They have to tell us which bank to pull it from, okay? Because they're not getting additional time. Then their time does not roll over, and it requires advance notice, which is called advance notice standards. So those standards are gonna be 7 days for something foreseeable, 24 hours for something that's unforeseen or as soon as is practicable. Then people can be denied, we can deny for non-compliance with the advance standard for operational purposes or for safety. So again, there are some exceptions to who, like this doesn't apply to collective bargaining. They would have to bargain for it. Some new employees, so I believe the intent around this was for hourly workers, people who don't get any benefit time now, right, is to accrue new time. So we do have some seasonal employees that will begin to accrue time. It's 1 hour for every 40 hours. And again, that's a maximum of 40 hours. And it could roll over for any unused time, but they don't get it paid out upon termination. Now, the tricky thing is you can't use it for 90 days. So most of our seasonal employees, right, they might be here for 90 days, so they could accrue time. Now, if they come back within 12 months, they could start their bank with whatever they left. I believe the county is going to continue to look into some of this. It is being challenged by numerous
Business.
bills, yeah. So there could be more to come, but just wanted to give you an update that beginning March 31st, people can begin to utilize this time. Does anybody have any questions on that? Okay. That's all I got.
Director Noel?
Thank you. Just a quick reminder that we are still doing our battery collection, so if anyone else has to bring in, we're doing it through Wednesday of this week. We have actually collected so far approximately 1 ton of
Oh, my gosh.
in the month. So it's actually a very popular thing. People do appreciate it, and they look for it and they bring them in, so we appreciate that. I just wanted to quickly point out that I did put a report in the information sharing section this month related to septic system installations in our county. This is an annual report that we do with IDPH, and then they roll up all that information statewide. And of course, since the 90s when we used to do hundreds and hundreds of installations every year, last year we did 142. And in spite of that very low number, we're about 7th in the state where we were last year. So it kind of gives you an idea of really the drop in the number of systems being installed. We're at about 60% that are replacements and 40% that are new. I think all of you know this, but we're 100% subsurface systems in McHenry County. Our methodology for on-site wastewater is soil-based treatment. And then where we used to have almost 100% gravel-based systems, now we have 80% chamber systems, which are, those plastic fabricated chambers for a number of reasons. Ease of installation, things like that is one of them. Additional credit based on surface area is another. So it's really kind of past 10 or 15 years flipped the other way. About 15% of our systems use pre-treatment, particularly aeration, and a very small number are more complicated systems like mounds or at-grade. So it's just kind of interesting statistics, just kind of the trending that we're seeing in private sewage and on-site wastewater, and I think it's going to continue that way for a while. So that's what I wanted to share.
Is that the trend of the industry, or is that as a result of new additional requirements?
No, I think it's more industry-wide. I mean, I think across the state, this is what's happening, with these different types of systems. And, new technology and things like that, that's a good thing. There's nothing wrong with that. It's just interesting, having seen 100%, gravel systems and everything, and it's really, the industry is changing significantly. So there are some benefits to our residents, of course, in terms of additional credit and things like that for sizing. So it does give our residents on small lots, particularly some flexibility they didn't have in the past, which is nice. So, cool.
Any other questions?
Yeah, quick one. Do you sense a trend that there's a reduced number of installations going on, new installations? Is it, if I understand you correctly, Is it just that the total number of homes being built is down, or that do people prefer to be on septic or on sewer rather than septic, or is there any feeling about that?
Sure, well, I think it's a combination of things. I think that there are definitely municipalities in different areas within the county. Wonder Lake being a good example of one where, you know, they have a very large new subdivision that's all on community municipal treatment as opposed to on-site wastewater treatment systems like the rest. So that is part of it. And then I think part of it is certainly construction costs, because we issue many more permits than this. These are actual installations. So we've heard from people that, you know, they will get a permit, they'll want to do a project, and then it doesn't come to fruition. But I think it's just a combination of all of those things.
Thank you.
Anybody else? Director Karas?
So I have a couple updates. I'm not sure if anybody has been looking at the opioid surveillance, but we have identified another cluster of suspect overdose deaths. We have met with our community partners and are targeting those areas that we're seeing those to provide education regarding Narcan. And tomorrow we will be releasing notification to the public to provide education on where to get Narcan and fentanyl strips. In the media, measles is very popular right now. We have had some contacts here in McHenry County that we've been monitoring. No cases as of this date. However, we are preparing schools and getting messages out to those schools and daycare centers and hospitals, healthcare providers on to be prepared what to watch for and how to get a hold of us if they identify a potential or suspect case.
Any questions? You've had some press releases on the neurovirus. Has that subsided?
It is getting better. We still have an active outbreak right now, one. We just saw that typical peak. It is not unusual for what we were seeing. It's just that we wanted to get the information out to the public just to remind them to wash their hands and how contagious norovirus can be.
Very good, thank you.
What areas are the overdose?
We cannot share that information because it's suppressed.
Okay.
Our partners are aware of it. We do share it with our partners that go out and do that education so that we know what areas to target.
Okay, thank you.
Director Marin?
Thank you. Update on the ARPA project for the Crystal Lake facility. We did go out for RFP as I reported last month, and we reviewed all of those bids. There were 11, and the bid will be awarded to Kluber Architects and Engineers at the county board meeting on March 26th. The design work will begin shortly after, and we are hoping to start some construction in July or August. So we're very excited about that moving ahead. As Mr. Clark noted, Public Health Week is April 1st through 7th, so we have a lot of things planned for staff. We have 2 trainings at MCC. You have the power, effective strategies you can use to relieve workplace stress. That'll be on Monday, April 1st, and a second one, understanding yourself and others for personal effectiveness. Who am I? On April 2nd. We also have 2 30-person classes of active shooter training with McHenry County Sheriff's Office, so thank you to them because that was kind of tough to get 30 and 30 in a class. So we also have an all-staff meeting taking place on Wednesday, April 3rd at noon. That will be inclusive of lunch. We'll be reviewing the strategic plan, some HR issues. We'll have a new employee EAP and new health insurance items that we'll be reviewing with them. Any questions that they have, the employee assistance program, I'm sorry. And then we'll have trivia games and other groovy things all week long. That'll be a lot of fun and related to public health. So all our trivia will be public health questions. In communications, we are doing several social media and basically public service announcements through a grant that we have, and it's public health as a career. So Nick Kubiak has been going around interviewing different employees in all of our different divisions on what they do and why they love what they do. So that is part of a grant, and we hope to have those up, and we'll let you know so you can watch them. and just kind of see what everybody does. And that's all I have.
Any questions, comments? Thank you. Speaking on behalf of the Animal Control Department this evening would be Janelle Carlson. Ms. Carlson?
Upcoming for, obviously, vaccination and registration clinics are due this spring. So we have 2 dog clinics, April 16th and May 21st, and a cat clinic on May 14th. We are doing special package pricing this year. So if your dog is fixed and you're getting a 1 year, you will either be getting a microchip, or if your animal already has a chip, and it'll be $20. If your animal's fixed and is either getting a chip or has a chip, it'll be $50 for a 3-year vaccination, and the microchip, the registration tags, all of those are included in the package. For the cats, for 1-year vaccination tags, if they are fixed and getting a chip or have a chip, special pricing will be $15 for that package for those animals. We have microchip clinic coming up Saturday, April 6th, 10 to 2, $10 for general public and $5 for veterans who show proof that they are veterans. We are working with our fleet manager for a new truck to replace the expense of our current truck. It'll be a good project that he's helping us with. We've recently received a $7,000 payment to cover the cost in a previous criminal case, so we've recouped some of our money there. And we currently confiscated 46 cats with Island Lake PD, and those criminal charges are pending. They are owner's duties, which is a Class A misdemeanor, and animal cruelty, cruel treatment, which is a Class B misdemeanor for those animals. That's all I have.
Any questions, comments?
I have a comment. It relates to animal control for the proclamation, and just as a notice for everybody here. I've been on this committee and the advisory committee for many, many years prior to the TNR program. And it's important to take note that they were euthanizing 900 cats a year plus. In 2003, that number was, and I don't know the dogs, but it's similar data. The cats were 380 some, and 2023, it was 47. So it's like an 87% reduction in euthanasia, and I think that deserves some recognition for, that's 20 years. And they got there pretty quickly with the trap, neuter, return program and releasing cats back into the environment where they're feral instead of killing them. I think it's been a great success, and I think they should be commended for that. And the other question I had is, I know you mentioned it, but the state came out with a veterans proclamation basically that says if you can show proof of being a veteran, you can get the animal for free, and it's affecting animal welfare organizations as well as animal control. I know there's some petitions going on about that. I don't know if you guys are participating in that, but anybody that was a veteran, regardless of income, can get a free animal. I don't know if that process for adoption is still valid, like if you say that they cannot adopt it for whatever reason, is still in play. Do you know?
According to what is in the state statute, I believe I don't remember the exact wording, but I do believe they said passing the shelter's approved application process.
Okay.
So I don't remember the exact wording, but they do have to pass our application process.
Thank you.
Yep.
When will animal control start taking appointments for the April 16th clinic?
I believe those appointments are gonna come up within the next week or 2 here. They're working on the online appointment calendar.
Okay, thank you.
Question for you, on the, not just the specific case, but in all general cases, the 40-some cats, does that result in a single charge for each animal, or one charge to cover them all?
It's up to the police department
Okay.
because they are the ones that are charging. As of right now, the officer said there is one cruel treatment charge, which is the Class B misdemeanor, for each owner, and 4 owner's duties charges, which is a Class A misdemeanor for each owner. So each owner is holding 5 charges.
Is it, because Island Lake is in McHenry, obviously, and it's in Lake County. Is any participation from Lake County at all?
I don't believe so
Okay. And where are all the 47 cats?
with us at the moment.
It's a full house.
Did anyone have to,
46.
46?
Dr. Kennedy had come in and examined them when they came in. So,
And are they healthy for the most part?
for the most part.
How long do you have to hold them for? I forget. Until the bond?
I
The
believe.
surety bond?
I believe until the case is over, or until the owners decide to relinquish or forfeit. So that varies depending case to case.
Thank you.
Is our state's attorney's office involved at all? Okay. Thank you. Anybody else? Thank you. Manager Dietz?
Still working on updating and creating policies and procedures. We're getting everything up to date, making sure we have everything covered. The county outside auditors are here now. They're performing their annual audit of the county, and I'm working with finance to provide data that they need about the health department. We also have our Medicare Part B revalidation that is due in April. Excuse me, we have to revalidate every 4 years. We're about a year behind now because COVID threw the schedule off. So, and then there's something that I will talk about later in the program on our FAR audit.
Okay. Who do we use for the outside auditor?
Baker Tilly?
Okay. Thank you. Any other questions or comments? Dr. Tomaso, do you have anything to report?
No.
Nope. Dr. Amsler, would you care to comment on the consent agenda?
Would you care to comment on what?
The consent agenda,
Oh, yes.
or make a motion.
I would like to make a motion to accept the consent agenda.
Second?
Does anybody have any questions or comments or want anything removed from the consent agenda? I should have asked that before. No, thank you. As it is a monetary issue, a roll call vote, please.
Dr. Amsar,
Aye.
Ms. Gaffney,
Yes.
Ms. Borowski,
Yes.
Ms. Clark,
Yes.
Dr. Katz,
Yes.
Ms. Eltoff,
Yes.
Ms. Carmen,
Yes.
Ms. Ortiz,
Yes.
Mr. Marcuson,
Yes.
Mr. Clark.
Yes. Motion, majority in favor, motion carries. I'm encroaching on your area.
That's fine. No, I want help. I was like, does he need help?
No,
Okay.
I manage,
I will shrink my.
I'm fine.
Item 7 on the agenda, contracts and agreements. 7A, anybody wish to comment on 7A? Anybody from staff?
Yeah, so this is a nursing agreement around information sharing, outreach, and referral, so I'll kick it over to Susan.
This agreement is between Head Start programs and our health department as far as just sharing information regarding WIC in particular, as far as getting nutritional education to these students in the Head Start program, and as far as sharing other information regarding getting them enrolled and helping with that.
Questions, comments?
This has been an ongoing one, this is just a refresh.
It's like a renewal.
Yeah. How long have we been part of this?
As long as I've been here.
Okay. I like that threshold.
Which board member would like to be recognized?
I'll make a motion to approve the MOU Community Action Agency McHenry County Head Start.
I'll second.
A motion has been made by Mr. Arkinson, seconded by Ms. Borowski. As it is a contract issue, roll call vote, please.
Mr. Markison?
Yes.
Ms. Borowski?
Yes.
Ms. Ortiz?
Yes.
Dr. Katz?
Yes.
Ms. Eltoff?
Yes.
Ms. Clark?
Yes.
Ms. Gaffney?
Yes.
Dr. Ansler?
Yes.
Ms. Carmen?
Yes.
Mr. Clark?
Yes. Item 7B is a memorandum of understanding, Sheltered Village and Henry County Health Department. Staff, care to comment?
Yep, again, it's another nursing, all of them are nursing
Okay.
tonight, so this is about immunizing our
Yes, this
population.
is an agreement with Sheltered Village that we have, that we would go on to into their facility to provide vaccinations such as flu or COVID as needed.
Questions or comments?
I want to move to approve it.
Okay.
I'll second it.
Motion's been made by Dr. Amsler, second by Ms. Altoff. A roll call vote, please.
Dr. Ansler?
Yes.
Ms. Eltoff?
Yes.
Ms. Ortiz?
Yes.
Dr. Katz?
Yes.
Ms. Carmen?
Yes.
Ms. Gaffney?
Yes.
Mr. Markison?
Yes.
Ms. Clark?
Yes.
Ms. Borowski?
Yes.
Mr. Clark?
Yes. Majority in favor, motion passed. The next item is 7C, resolution appropriating $5,000 to Nacho Award.
Nacho Nacho.
I got him. I got him.
Yeah.
For MRFC readiness. Staff?
So this is an award that we applied for this funding to help for our operational readiness. We were awarded $5,000. We will be using this money to train more MRC volunteers to be CPR instructors, as well as ASL interpreters, because during COVID, we ran into that issue. So we're gonna try to get some of those interpreters on board in our MRC, and as well as any equipment or supplies that we need.
Questions or comments?
Mr. President, I'll make a motion to approve the resolution appropriating $5,000 Nacho Award for MRC readiness.
What, come on, you have to say what it means.
Nacho. Nacho.
I will second.
It's 2 orders of nachos.
Nacho problem.
A motion has been made by Mr. Markison, seconded by Dr. Katz. Roll call vote, please.
And I also say natural.
Mr. Markison?
Yes.
Dr. Katz?
Yes.
Dr. Ansler?
Yes.
Ms. Carmen?
Yes.
Ms. Eltoff?
Yes.
Ms. Gaffney?
Yes.
Ms. Ortiz?
Yes.
Ms. Clark?
Yes.
Ms. Borowski?
Yes.
Mr. Clark?
Yes. Majority in favor, motion passed. Next one is 7D, resolution for emergency appropriations of $5,000 in MRC Strong Grant Award.
That is not a typo, by the way.
So this is another award that the MRC program applied for and was awarded $5,000 from the Medical Reserve Corps of Illinois to help with building up our capacity. So these funds will be used for bilingual recruitment materials and media, and as well as some additional training and onboarding those new members.
Questions or comments?
I just have a question. Is there a $5,000 threshold cap, or are we awarded $5,000 because of population, or is there no marker or metric related to this grant at all? It's just kind of sort of whatever.
It is kind of whatever. But we pretty much have gotten the $5,000 for multiple years now.
High performers.
Any other questions, comments?
Move to approve.
I'll second.
Motion's been made by Dr. Amsler, second by Ms. Borowski. Roll call vote, please.
Dr. Ansel,
Yes.
Ms. Borowski? Yes. Ms. Carmen?
Yes.
Dr. Katz?
Yes.
Ms. Ortiz?
Yes.
Mr. Markison?
Yes.
Dr. McGuire? Oh, sorry. Not here. Ms. Clark?
Yes.
Ms. Gaffney?
Yes.
Ms. Eltoff?
Yes.
Mr. Clark?
Yes. Item 8 on the agenda is new and unfinished business. 8A is annual report.
Say it 5 times.
Yeah.
8A annual report. So, I think it speaks for itself. So we are required to do an annual report every year, get it published, posted online. So, assuming you all approve it tonight, then we will get it printed professionally in booklet format. Mr. Clark has already asked that you each receive a copy of that, but we wanted to make sure you didn't have any other changes before we push it to print.
Dr. Amsler, care to make the motion?
I move to approve the annual report. And I just want to say as a side comment, I think that both you and Melissa did a wonderful job in summing up the health department's quest and desires
Thank you.
moving forward. Thank you.
And it's a beautiful picture of you guys.
You can thank Nick. He had to take quite a few.
Do I hear a second for the motion?
I'll second it.
The motion has been made by Dr. Amsler, seconded by Ms. Clark. Let's do a roll call vote on this, please.
Dr. Ansler?
Yes.
Ms. Clark? Yes. Ms. Eltoff?
Yes.
Ms. Gaffney?
Yes.
Mr. Markison?
Yes.
Ms. Borowski?
Yes.
Ms. Ortiz?
Yes.
Dr. Katz?
Yes.
Ms. Carmen?
Yes.
Mr. Clark?
Yes.
How do we normally distribute the annual report to the public in general as well as to the board, county board?
Oh, I feel like that is a great question. I'm trying to think if we have done press releases in the past, but we always, it's always brought here for approval, and then we post it online. Do you recall last year if we sent out a press release about the annual report?
I don't know.
I don't
I don't think we
recall,
did.
but it was available online and
I strongly suggest we do a press release.
Okay.
And I strongly urge consideration that our board president attend a county board meeting and distribute a copy and maybe note some highlights. Let them see you. Let them know exactly what this board has been doing. I am finding that, there's been a huge turnover in the board, and there's a lot of people that don't even know, A, what the mission is, and B, that there's an individual board and what the mission and mandate and statutes require of a Board of Health. So I'm suggesting that's a nice little softball approach. Here's the annual report, highlighting some of these wonderful things you pick. And thank you very much for being here. And I check it with Peter on how to do that, but I would definitively make an appearance.
Good
I can do that.
Great idea.
To get on the agenda or does a public comment?
No, we have to get.
I think I would do it on the agenda. I would do it at like the committee of the whole where we're a little bit more relaxed and so you have a little bit more time. And just say that, here's who we are and this is what we do and here's the annual report and have copies for everybody. Because regardless if it's on, nobody goes and reads it. Join, do another, that would be great.
Right.
That would be
What'd
really
you say?
good. Thank you.
He's gonna be his wingman.
I'll bring nachos.
I do.
You better check with Patty first.
Lupe will translate.
I'm saying that somewhat, tongue in cheek, but I am serious. I really believe that, and I've also made a recommendation so you know that you guys be included in the orientation of the new board members in December of this year. So be prepared.
Well, you might have all the department heads show up with the proclamation and read that into the record at the county board meeting as well.
They usually do. Somebody usually does read it and do it. But I'm serious when I look at you. I truly believe that even many that have been here for a long duration have no idea that there is a Board of Health. and what it is that gets done. Would you agree with me? Off the record?
But you're on the
I think every time there's a new, like, we have been involved in orientations.
Not a
so we do
criticism.
try. Yep, no,
Observation.
I'm not taking it that way. But I agree that we have to, and it's not just us, but we have to re-educate members all the time. And I think they definitely don't always understand the breadth and the scope of the work that gets done.
I made the same recommendation for the board, for the mental health board too, same thing.
So I can work with Peter too.
I agree. Will you make the arrangements?
I will make.
Thank you. Let me know. Thank you. Any other comments on the annual report? Okay, next item is item 9, board issues. Any board member have an item that they wish to discuss?
I just have one. I know that the environmental health isn't working on it, and Kelly's talked to me about it, but I would really like to see push so they were gonna update for school lunches about offer versus serve and the share tables, because especially next week, the first week of April is food prevention week, and our team at the Defender has been really working on with schools and trying to get food waste diminished, because the law is that the kids, they have to be offered those choices, but they don't have to take them. So schools that have done that, just like with, in one school, small elementary school in Crystal Lake, they did offer versus serve. So instead of having 70 bags of carrots sitting there, and those would have normally gone to the garbage, or hopefully someone would pick them up and take them to, to a place to be donated. Since they did offer versus serve, there's only a handful of like bags of carrots left. Like, it makes a huge difference in the amount of food waste in the school, and it does save the school, money as well. And there's just a discrepancy right now versus the law of Illinois and the books what's on here in McHenry County, and I know they've been working on it, but I'd just like to see if it can get done sooner than later.
Yes, I would love to speak to that. So I don't believe that there's any discrepancy if you're talking about from a food safety standard with what Illinois would allow with what McHenry County allows. That is actually a universal food safety principle. Those are very, very standardized. But yes, Kelly and Christine are working on that actively. I know they had a meeting this week. They're working on it cooperatively. We definitely share your concern and want to minimize the food waste. And I just have to say that we always have to balance that, with the foods that are set aside and donated are foods that are safe and wholesome, as they move down the chain. So really, that's what any concern that we would have would be. Not that we have any objection to salvaging food and using it and things like that. So actually, I know that they did meet, I think it was last week or Friday or Monday, something like that. So I know that they're actively working on it, but I can touch base with them. But it's within the last few days.
Oh, okay.
I'm sure.
All righty.
So it's not like it's not on the radar.
Okay, yeah, I knew it was, I was like, I know it's not like, yes, of course with the food safety, but it's more like,
Sure.
If the kids can just be, instead of having to take the food, knowing that it can just be offered, that right there reduces the food waste. And and just offering the share table at the end of the lunch period, a kid who's in need can take those, a couple bags of carrots, put them in their lunchbox, and take them home. Where there's,
Can we just put that on the agenda for next time, just get an update? So you close the loop?
Sure.
Can we do that, maybe? Sort of.
Consider it done.
Consider it done.
Any other board members have an item they wish to discuss?
I have one little thing,
Of course.
No, I don't usually say anything during board issues, ever. This might be the first time. You guys may have addressed this, I wasn't here last month, but just a point of attention to it, and also to say, an attaboy to our health department. I heard or was invited to this, Congressman Foster's got a town hall in Crystal Lake.
Yeah.
And I didn't know that, so one of our members from the health department's attending, Taylor Cerrone, or she's gonna be speaking there. So I just wanna say that's outstanding to see, and love to see the outreach. And if you hadn't heard about it, it's on March 23rd in Crystal Lake.
She's the best. She speaks often to youth and to youth serving agencies and has been on many panels with me. She's amazing.
Do we know how the outreach happened? Did Congressman Foster
I think he
reach
reached
out to us?
us, yeah.
That's even more
To
impressive.
Northwest Medicine, who's on the substance.
And so that's how it kind of trickled down?
She brought
Cool.
Taylor on board.
Okay.
He's actually met with us though before. I think he's been a couple years.
I can't wait
He
to-
came in and sat down and met with us.
That's impressive.
I'm sure I'll be wowed by her when I attend, so looking forward to it.
Very good. Next item on the agenda is information and communications. 10A is Illinois Department of Public Health Septic System Report. Okay. That was what we discussed earlier as far as types and changes in the septic systems in McHenry County. 10B.
So Karen's going to speak to this, but this is our fiscal and administrative review through the Illinois Department of Human Services, or WIC, Breastfeeding Peer Counselor, Farmers Market Nutrition Program, and our high-risk infant follow-up programs.
So they, the last time they performed this audit was in 2021. They did it again in 2023. It began around August. The audit pertains to county policies, not just health policies and procedures. They requested about 30 documents and policies from me to start, and then they asked for additional ones as we progressed through the audit. At the end of January, the results were finalized, or actually not finalized, they're draft. So, and they were sent to us, and there were 2 findings out of all the stuff that was provided. It was for a property control inventory policy and then a cost allocation. We're continuing to work with them on getting a completed audit. There's still a couple questions that we're working through with them.
I just, after the report is finalized and we have a copy, I would just like to know how we're going to address the findings, how we're going to correct the findings.
Right, so we're working on that now.
I know you are. I have no questions. I just want to make sure that it's presented to this group so that we know, and there's some follow-up. I'm all about process right now.
Yep, and actually the final, once everything is final, a copy will go to Mr. Clark as the president of the board. So we did want to include it though to give you the information and let you know where we were in the process, and that we do have to develop and respond to the findings, and we have draft policies already in place for that.
Perfect, thank you.
It's my understanding that this is more than just the health department concern.
Mm-hmm.
Do you have any comment on how the county is gonna address it?
I know, no, I don't know how, but I know that they will, and we will be informed, which is why I'm just repeating it so that there's documentation from this board to other boards. That's my only concern.
Yeah, and just another comment that so I did say this was our WIC Breastfeeding Peer Counselor, but actually it also includes a grant over in community development. So it wasn't just, they were auditing the county's programs that fall under IDHS, but we were the ones providing the information to them. So we did have to work closely with county, and if we didn't have a policy, we reached out to county, because in some cases they were requesting a county policy. So there's been a lot of back and forth about, well, we don't have it or the county doesn't have it. So this is where it landed with the 2 corrective actions that we need to do.
I'm only really making sure
that it comes back.
But also that the board understands that this body reviews, supervises, oversees, use the right word, of what happens also in the department, in the agency. That's what I want. Okay.
Any other questions or comments? I look forward to hearing from staff on this. Okay. Is there a need to go into executive session? Item 11. Hearing seeing none, we'll move on. You have, in your board packet, you have the appendix with some items for your review. Item 13, adjournment.
I make a motion to adjourn.
Of course you will.
Second.
Motion has been made by Ms. Gaffney, seconded by Dr. Amsler to adjourn this meeting. All those in favor say aye.
Aye.
Those opposed say nay. Ayes have it, motion carried.